Thank you and welcome. This is an hour-long webinar on effective communication for school success. Few things to know. Just going to cover a couple housekeeping pieces with you tonight. So again, it's an hour long. In order to have the best bandwidth, you'll want to make sure you don't have too many things open on your computer, such as music applications, which will result in poor quality experience. If you do have questions, I want to let you know that the questions will be taken at the end. You might have questions that you want to share throughout, and we might be able to address them throughout the presentation, but we may end up saving them for the end. So feel free to either hold those questions or you can share them as we go. And I'll share in just a moment about what that looks like. You'll receive a certificate of completion within 3 business days in a follow-up email. This webinar will be posted on our website for future viewing options. And I want to share a little disclaimer. While the Epilepsy Foundation of Minnesota is hosting this webinar, all content and discussion points are led and delivered by our presenters today. The information shared is to inform you of the aspects of effective communication for school success. However, all potential treatment options should be discussed with your medical provider. So I mentioned that there are different ways to ask questions. So we'll answer those questions at the end. However, we encourage you to ask questions at any time. So to avoid any confusion, you'll notice that the chat has been disabled. You might have used chat before in other Zoom meetings. You'll see right on this slide that there's a little circle around where it says Q&A. That is where you can type your message if you have a question, and the presenters will see it. And then we'll again either be able to answer them at some point throughout the presentation or at the end. All right, and at this time we are going to do a poll. So you are in just a moment going to see this first poll come up. There we go. And so the question, what is your relationship to epilepsy? And it's multiple choice in case you have more than one relationship to epilepsy. So we'll give you a little bit of time to answer. Go ahead. Just helps us get an idea of who's attending tonight and how you are connected to epilepsy. All right, it looks like we have just a little bit more. We have almost everyone participating. And so I'm going to give you just a couple more seconds here. And then I'm going to go ahead and I'll end the poll, and then you will see the results on your computer. All right, so you can go ahead and take a peek at that. You'll notice that most people here today have a child with epilepsy or another family member. And we have one person here today that has lost someone to epilepsy. So thank you again for sharing what brought you here today and how you are connected to epilepsy. I'm also going to do a second poll right away because there's 2 back-to-back that we wanted to ask you. So you're going to see the next poll starting right now. All right, this one is, what do you hope to learn at this webinar? Again, it's multiple choice. And the answers are impacts of epilepsy on students, tools and resources to support students with epilepsy, how 504 plans IEPs, IHPs, and EAPs are used in the school setting, communication strategies. It helps us know a little bit about what you're hoping to gain from this webinar today. All right, and we have had almost everyone. There we go. All right, and I think it probably hopefully shared the results with you. Are you all seeing it hopefully? Okay, perfect. And so we see kind of a mix. Everybody is hoping to learn about the impacts of epilepsy on students. And it looks like a lot of people here are also looking to learn about tools and resources to support students. And some people are looking for some specific information about 504s, IEPs and such, and the communication strategies. So thank you so much for sharing a little bit about what you're hoping to gain from today. There we go. All right, so we've completed our first 2 polls. At some point later on, you'll have another opportunity to share some feedback with us. So the next thing I'd like to do is share a little bit about who we are tonight. So I'm Lisa Peterson. I work for the Epilepsy Foundation of Minnesota. I'm the Regional Outreach Manager in Northern Minnesota. And so thank you so much for being here. And I'll be helping with the event, but most of this evening will be with our presenters. So I'm going to at this time share a little bit about the people that we have with tonight sharing. So on this slide, you're going to see a little bit about Lynn. Lynn has spent the last 12 years in school nursing in a level 4 setting, caring for an array of students with physical, mental, and emotional challenges. Prior to that, she spent 25 years in hospital nursing, in orthopedics, neurology, and intensive care. And Lynn has also supported EFMN as a Camp Oz nurse. So thank you and welcome. We're so grateful for you to be here tonight, sharing your expertise with us.
Thank you.
And we also have Shayna. Shayna Schoen is a school nurse. She's been working as a school nurse for the past 15 years, caring for students ages pre-K through 12. She also oversees the district health office. Prior to this position, Shayna worked for 3 years in public health. And prior to that, she spent 1.5 years in a hospital medical surgical unit. Shayna also serves on the EFMN Regional Advisory Committee as well as the Professional Advisory Board. So we are delighted to have 2 experts with us today who not only work in the field, but are very committed to supporting students with epilepsy and their work as a volunteer here at the Epilepsy Foundation of Minnesota. So thank you both, Lynn and Shayna, for being here with us this evening. Next, I want to cover what the objectives are. The objectives of this training are to increase your knowledge of how epilepsy and seizures impact education and learning settings, to gain tangible tools and resources related to epilepsy in the school setting, to describe key components of 504 plans, IEPs, IHPs, and EAPs, and to identify effective communication strategies to promote success for students living with epilepsy. At this time, I'm going to pass it off to Lynn, our first presenter for this evening. So thank you again, Lynn, for being here with us tonight.
Thank you. Hello, everyone. We're going to start out with a brief overview, including the prevalence and statistics, as well as a few definitions, triggers, and seizure types before we get into how to best help students with epilepsy in the classroom. 1 in 26 people will be diagnosed with epilepsy at some time in their life, and 1 in 10 people will have a single seizure. That's why it's so important that we raise awareness around the issue. And next, epilepsy is the 4th most common neurological condition after migraines, strokes, and Alzheimer's disease. It is a leading brain condition in children, and 1/4 of the people with epilepsy live with uncontrolled seizures. Adults with epilepsy are more than 4 times likely to have co-occurring chronic conditions, and those can include anything from ADHD, which often goes undiagnosed, mood disorders such as anxiety and depression, migraine, sleep disturbances, autism, just to name a few. Next. So anyone can develop epilepsy at any time during their lifetime. Age, demographics, and location can add additional challenges. People with low economic status are 2 to 4 times more likely to have seizures than the general population. African Americans and Hispanics account for about 40% of the people in the US diagnosed with epilepsy, and in contrast with just being 30% of the population. Approximately 1/3 of the children with epilepsy live in food insecure homes, and about 50% of the adults with active epilepsy have annual family incomes less than $25,000. So you can see there are some disparities to be aware of. What is epilepsy? Epilepsy is defined as a neurological condition characterized by unprovoked recurrent seizures, also known as a seizure disorder or a seizure condition. And by neurological, we mean happening in the brain, as you can see on the slide. And unprovoked says that they do not occur because of another medical condition. Next. A seizure is a sudden excessive discharge of electrical impulses between brain neurons. A seizure is a finite event that occurs either as a one-time occurrence, and some examples of that might be a diabetic with low blood sugar, or someone going through withdrawals from drugs or alcohol, or we think of the little ones in the febrile seizures, or it can be a symptom of epilepsy where we can see these occur. And in most cases, there is little or no memory of the actual seizure after the episode, and people can have more than one type of seizure. I'll just throw in one other type of seizure here that's not neurological related, but psychologically related, and that's the non-epileptic events. And we often see these in school, often if they're under stress or something like that. Again, hard to depict between the two, but we are just looking to find the underlying cause of something like that. We'll talk a little bit now about the triggers. A trigger is something that occurs before a seizure at times. The most common trigger you can see is missed or late medication. And we want to make sure that, especially in the school setting, if they're to be getting medication, that they are receiving it on time, and then also that we have a supply of that. Other triggers can include lack of proper sleep or rest, high stress, poor diet or nutrition, dehydration. Hormonal changes can often be a trigger as well. And we see that in school kind of in that puberty range. Or I have seen it in transition, like the 20 to 22-year-olds. And all of a sudden they've had great seizure control, and now all of a sudden they're having a lot of breakthrough. So time to kind of look at those hormones. They may need some medication adjustments. The other one we think about is photosensitivities, and that only affects about 3% of those with seizures. However, we think about the TV screens and all the computer screens that we're on. And the other thing in a school setting is the fluorescent lights. Sometime we need to kind of cover those up or dampen those out if we have children that are bothered by that. And we'll go to the next slide and talk about seizures. There are about 40 different seizure types, and the name and definitions of those have changed over the years. But these new names better describe where in the brain this is happening. They can be a focal seizure, and that means it's just happening in one area of the brain, or generalized over the entire brain. And sometimes that takes a little sorting out to figure out just exactly what's going on, especially with the fact that they can have more than one kind of seizure. The second thing we look at is awareness. Is it altered? Yes or no? Are they aware of what's going on in the seizure, or do they have no recollection of that? These classifications are important because it can often lead to what is going to be used as a treatment plan. I think that's about it for that one. I will talk just a little bit about a few different seizures, two of each. The first one is the focal aware seizure. And in the focal aware seizure, the individual is aware of what is happening, but they can't control it. So that's where we might see the shaking of the hand or something like that, and they just can't stop. But they are aware that they have it. The other focal aware seizure that we really need to pay close attention to is sometimes we don't even see any outward signs of it. It might involve their senses. They may taste or hear or smell something. And my best example of this one, I had one student that always would taste a metal taste in their mouth is how they explained it. So when they said that, I knew to kind of watch for what might be coming next. The other thing, they may feel unexplained emotions such as sadness, anger, or joy for no apparent reason, and they might not even be aware of this. And typically these seizures last about 2 minutes, and can go undetected or misinterpreted. Next, we'll go over the most common type of seizure, the focal impaired awareness seizure. And in this type of seizure, they're not aware of what's going on. They're unlikely to remember what happened during the seizure unless it's extremely brief. There's often confusion associated with this, and that confusion, when they come out of it, they don't know what happened. So they really need to be brought up to speed about where they're at and what they missed and just what happened. And these usually last about 3 minutes. Again, these can be misinterpreted as drunkenness or intoxication, being high on drugs, some mental illness, or some disorderly conduct. And again, like with all types of seizures, we want to speak calmly. We want to keep our emotions in check. We don't want to restrain anybody. We want to offer them assistance in the postictal period. And the individual may not be aware that they had the seizure. So if we can go ahead and bring them back up to speed. The next two seizures we'll talk about are generalized seizures. And the first one we'll talk about is the absence seizure. And that was formerly known as the petit mal seizure. And the individual is completely unaware of what is happening during the seizure, but quickly returns to full awareness once it's stopped. So we might see these just lasting a few seconds. They might just seem to be daydreaming, dozing off, that kind of thing. But we might see this happen many times a day. And again, we're going to treat it the same as any other seizure. We're going to make sure that we offer emotional support, time the seizure, let them know what happened, and bring them back in as they're able. The grand mal seizure is the last one that I'll talk about, and that was formerly known, or the generalized tonic-clonic seizure, formerly known as the grand mal seizure. Typically, this is the one that people think about when they say, oh, somebody has seizures. We might notice a loss of consciousness resulting in a fall. This is where we'll see the body stiffening and some rhythmic muscle jerking. We want to pay special attention to their breathing because sometimes that is altered. We might see blueness around the mouth. This is when they could lose bladder or bowel control. And typically these last about 1 to 3 minutes. And after the seizure, there might be a postictal stage where they're feeling tired or they need to rest or they need to be caught up, likely not to remember what happened. And I would say these are probably most of the students who have a seizure action plan in place and might have a rescue medication that we need to worry about taking. And again, we want to time the seizure. If we can know how long, when it started, when it ended. We don't want to put anything in their mouth. We want to loosen any restrictive clothing. If they have fallen to the ground, we want to turn them to their side to prevent any aspiration. And then let them recover as able for them. To return to their baseline. And usually they're a pretty good judge of that. You'll know if they need to sleep for a couple hours or if they're just ready to get right back up and do that. And again, I would say with any of these seizures, I tell everybody not to worry so much about trying to name the seizure, but more about what we see happening to them. Do we see that wandering around the room? Do we see them falling, the drop seizures, falling to the ground? Do we see them, they just can't know what's going on? They're daydreaming all the time. And just to kind of put those things out there so that we can pass those things along, and then the physician can help to just see what kind of seizure it is. After that, we'll talk a little bit about a seizure response on the bus. And I think as far as this goes, it's more about the awareness, communicating with the bus driver. Maybe if they're having seizures on the bus, we need to bring a paraprofessional in to keep on the bus. Generally, the bus can pull over to the side of the road and deal with the seizure. we've had people who have a plan in place that if they're closer to home, they go back home. If they're closer to school, they come to school. Oftentimes the bus driver will radio us and let them know we're coming so we can meet them at the bus. And I would say the other thing here is sometimes the bus company is not part of the school. It might be a contracted service. So we want to make sure to keep those lines of communication open. And then we'll talk just a few minutes about a seizure response in a wheelchair. Again, if they're in a wheelchair, they can often remain in that wheelchair. We want to make sure that the wheelchair is locked and that they're strapped in. They may need some support of their head. We can lean them back in the wheelchair if their wheelchair affords that. We might turn their head to the side so they don't aspirate anything. The time we might want to get them out of that chair is after the seizure, especially if they've got an emergency med that might be a rectal diastat. We might take them out. We might also take them out of the wheelchair if they need to rest afterwards, if we can't tilt that back. Then we'll talk just a little bit about a seizure response in the water. I would say I don't think there's a whole lot of swimming going on in school anymore. However, if there is, we want to make sure that everybody is aware that somebody might be a potential to have a seizure. And if there is a seizure in the water, we want to get them out of the water as safely and quickly as possible, and then go ahead and proceed with general seizure guidelines. Here we might think about wearing a life vest. We might think about a buddy system. We want to make sure there's a lifeguard on duty and plenty of help around just in case. We would always call 911 for a seizure in the water because we're worried about any aspiration or drowning that might occur, and this might not be evident until later on. So that is one reason you would always call 911. Just a little plug for Camp Oz here. They do require at Camp Oz, if you've had a seizure within the last 3 months, that when we're swimming, you need to have a life jacket. And if there's one person in the cabin that has to wear them, everybody will wear one so nobody, feels left out. And the other thing, the parents do need to sign a waiver about that. We'll talk a little bit about when to call 911, especially in the school setting. It's different for everybody. Somebody who has seizures on a daily basis, we're not going to call 911 all the time. Somebody has a first time seizure, yep, we might call 911. We'll call 911 if any injury takes place that we can't take care of, if there's any difficulty with breathing. If the seizure lasts longer than 5 minutes, we start to be concerned about status epilepticus, so we'll give a call. Again, like I said before, if the seizure takes place in the water, or if they have other health conditions such as a cardiac condition, or maybe they're diabetic, or maybe they're pregnant, we might call. And most importantly to myself and what I share with the staff, we can call 911 at any time if we don't feel like we can respond appropriately. That doesn't mean they're going to have to transport, but it does allow another set of hands and another set of thoughts. And also they have some things on that squad that we don't have. We don't have oxygen available in school. They might have some medications that can help us out. And then they're there if they need to transport. We'll talk briefly here about SUDEP, sudden unexpected death in epilepsy. Tough to talk about because we sure don't want that to happen to anybody. However, it does happen to about 1 in 1,000 adults every year and 4,500 children, and especially those with intractable or hard to control seizures. This is even greater, up to 1 in 150. So this is why we want the good control over the seizures. This might be a time when instead of just seeing their family doctor, if their seizures are out of control, they might need an epileptologist or a neurologist on their case. Another reason why we want to make sure that we have med compliance so that these things don't happen. And then also, if medications aren't working, this might be a time that they would go on to other therapies, such as some surgical interventions, or maybe the implantable device, or following a special diet. But we really want to get awareness out of this because it's something that maybe we can eliminate at some time. And then the last thing I'll talk about is a little bit about the medications, because oftentimes we are giving the kids the medications in school, and so important to communicate with the teacher and the nurse at school. Are they starting a new medication? Are they adding a new medication? Are they weaning off a medication? What other medications are they taking that we should be aware of? And that way, if we see anything out of the ordinary, we can be sure and report that back. I'll talk a little bit about sports and activities. Many of the students with epilepsy can and do participate in athletics and or physical activities. We want to make sure to plan ahead to make that a positive experience for anybody. Again, letting the coach know if there's any training that needs to be done. If they have a seizure action plan, we can share that with them. If they need any special equipment, a helmet or something like that, we can go ahead and have those things in place for them. And I think that's about what I have. We will pass it on to Shayna for some treatment options, documentation tools, and school supports.
Okay, thank you. So the first thing I will be talking about are some different treatment options that are available. There are many different treatment options that you might come across available for people with seizures. Sometimes people can be controlled and seizure-free with medications. So that is one option. Some may be candidates for surgery, special diets, or medical devices. And then something that's a little bit newer that we might be seeing would be the medical cannabis. Next slide. So kind of important to talk about when we're talking about medications are side effects. You know, there's some possible different side effects that we might see. Those may be displayed as either physical, emotional, social, and or cognitive. Possible effects we might see include things like lethargy, weight gain or weight loss, some cognitive, concentration, or memory difficulties. We may see hyperactivity and emotional or behavior changes. And just to be aware that, you know, despite having excellent care, as with any medication, some people might just have these side effects, and they may last, you know, for a couple weeks and then get better. So it's something that typically we like to at least give a couple weeks and see how things are going to go. So the cognitive, concentration, and memory difficulties we'll discuss a little bit more. And also to be aware, emotional and behavior changes, that those mood changes can be very strong, you know, especially with those big change in hormone times. Okay. Next slide. Oh, and a couple more things on that. You might also see appetite changes and nausea. You know, that can happen, you know, as a side effect of medication. Occasionally, we may need to have blood drawn to assess the blood level of the medication. And also to be aware, some over-the-counter medications can interact with prescribed medications. So if you are going to be taking any over-the-counter medications, make sure to check with your pharmacist if that could be a potential interaction with other medications you're taking. So emergency medications are typically used for seizure clusters, or when seizures are more frequent, longer, or more severe than typical. They are to be taken as needed and to prevent a seizure emergency from occurring. and they are not used as a daily seizure medication. And we see, you know, some different forms that they are available, rectal, buccal, and nasal. And kind of the ideal emergency medicine is going to be something that's easy to use. It's going to work relatively quickly, safe to use with little to no side effects. And there's different forms to meet individual needs and that they are going to work well. Some important things to think about with emergency medications. Who is made aware of their action plan? So when it's, you know, when it is needed for that child or person to have their emergency medication, where that medication is going to be located, and then who is able and willing to administer that emergency medication. So those are things that we need to have planned ahead of time, you know, make sure that we have that process down so that when an emergency occurs, you know, when somebody has a seizure that lasts a little longer than typical, you know, the right process can be followed. Another thing, you know, a medical ID bracelet might be something helpful to consider that could have information about that rescue medication, that is something that's available. And once that person is an adult and is no longer in the school setting or of the school age, that's going to become really important that they learn how to self-advocate. You know, so if they're on the job or independent as an adult, somebody would be able to respond to an emergency for them. Some of the common emergency medications that are prescribed would be diazepam, which would be Valium or Diastat, lorazepam, which is also Ativan, clonazepam, which is Klonopin, and midazolam, which is Versed. Okay, next slide. And so, like I said, emergency medications are available in these different forms, rectal, buccal, and nasal. And the plan for each student should be included in their seizure action plan. So how they are administered that medication. Administration of these medications can be delegated to school personnel. And, you know, if you're looking for resources on administration, the Epilepsy Foundation does have resources available. So that's something that you could reach out for or check the website. And so a little bit more about these, you know, the rectal form is administered in the rectum. The buccal is administered in the mouth between the gum and cheek. And nasal is administered through the nose as a nasal spray. And it's important to consult your physician and the manufacturer's instructions to make sure that those are administered correctly. And there's, you know, a lot of different, if you look up the manufacturer's website and look up that medication, you'll be able to easily find information on administration. And I would say that we're seeing a lot more of the buccal and the nasal forms prescribed now. So that is something just to be aware of. Okay, and next slide. Your child's physician may use an action plan like the one that the Epilepsy Foundation has available, or they might use their own. But this is kind of a typical seizure action plan that we see and that we use in the school setting. So this is something that you would have filled out by your child's doctor. And, you know, we like to have that filled out really thoroughly so that we have a good plan of what we need to be looking for and what we need to do if there is an emergency that happens. So, you know, the first section is just all that general emergency information, contact information, and then it goes over the type of seizure that is typical for that person. And then what is the protocol? What kind of emergency medication is ordered and how is that given? And then what are we going to do for basic first aid and comfort? And what do we typically see for seizures with this person? Any special considerations or precautions, and then any general communication. So that's kind of the typical areas that are going to be addressed in a seizure action plan. And these we do like to have updated, every school year, just to make sure that we're still following the correct procedure. Next slide. Next topic that I'm going to talk about are side effects. So tracking medication side effects can help families decide if additional treatments might be needed or if that medication seems to be working well and should be continued. So it's really helpful if we can also be tracking any of those side effects at school as well as at home. Students do spend quite a bit of their day at school. So knowing what's going on at school is really going to help if we can be tracking that and then relay that information to the physician. And a comprehensive evaluation by a physician is going to include both school and home side effects. And we want to be tracking any kind of noticeable changes in that student and relay that to the parent. And then there are different types of observation records that we could use for tracking. Sometimes it's actually a little bit easier for the school to be tracking some of these side effects because we're able to have more of a consistent schedule at school, have the ability to observe consistently and to see that student while they are engaging with their peers and working on tasks. So that actually is kind of a good time to be tracking. And some information about the observation records, they can be used to track seizure activity and side effects. A journal or a diary may be effective, and EFMN also has an observation record form on their website that could be used. And typically what we want to do is have about a 2-week time period to track that information so that that's going to be enough time for us to see any changes that are happening. Things that we're going to be watching for are any change in attention, focus, mood, or behavior, and then communicate those changes during that time with the parent so that you can be communicating with your doctor. Okay, next slide. So there would be, a lot of different options for how you could track this information. You could use just a seizure observation form like the one that's available on the Epilepsy Foundation website. And that's going to have, just some of the different areas that we want to track. And you can mark down what day that was, what time it was that you saw that. And then you can maybe see some patterns or see what's changing over time. Some people may use just a simple notebook or journal where they can jot down, the date, time, what kind of side effects or seizure activity or anything like that they're noticing. And then there's also some apps available. So if that's an easier way for you to keep track, 2 of them that we have come across there's one called My Seizure Diary, and then there's one called seizuretracker.com. So it kind of just is, it depends on what works well for you with your lifestyle, what's going to be the easiest way for you to track. And next slide.
All right, we are going to go ahead and do our next poll. So at this point, in one moment here, there you go. You should be able to see it now. What documentation between home and school do you use currently? So to help us to understand a little bit about what you're already using, if you're using anything at all right now. Thank you so much for everyone who's participated already, and I'll give you a little more time to go ahead and answer And then in just a moment, when I end the poll, you'll be able to see everyone's results. All right, we have just about everybody participating. And so one more moment here. All right, I'm going to go ahead and end the poll. And you should be able to see the results now. The results show us that a lot of people are using the observation forms. So the one that we have on our website, wonderful. Some people are using a notebook and some have, doesn't look like anyone right now that is on this webinar is using an app, but we do have some people using another form. So I'll be interested to find out what that might be. And some people aren't yet using anything. So thank you so much for sharing about what you're currently doing.
All right, so then the next topic would be IEPs and 504 plans. So an IEP is an individualized education plan. And this is a federally funded program for students who identify under the law as having one or more disabilities, is attending elementary or secondary school, and receiving special education services. This law is under the Disabilities Education Act, or Individuals with Disabilities Education Act, or IDEA, and it is a federal special education law for children with disabilities. And then 504 plan is for students who do not qualify for special education services, but have one or more disabilities that interfere with one or more basic life activities. Under this plan, students can receive services or changes in their learning environment to thrive in the general education setting at no cost to the student's family. And this one falls under Section 504 of the Rehabilitation Act of 1973 and the Americans with Disabilities Act, Amendments Act of 2008. So that's just a little overview of some of the different plans that you may see in the school setting. Okay, and then next slide. A couple more plans that we use typically. The IHP is an individual health plan that is developed by a school nurse for students whose healthcare needs affect or have the potential to affect safe and optimal school attendance and academic performance. These are documents that nursing services provide through the use of the nursing process and is used to develop additional plans needed for student success and safety. We develop these in collaboration with the student, the family, and the healthcare provider. And they're used to provide care coordination to facilitate the management of the student's health condition in the school setting, and to inform school educational plans and promote academic success. So that's a little bit more of a comprehensive plan, that's developed based on a health history. And then the last one would be the Emergency Action Plan, or the EAP. And this is developed based on information from the individual health plan. It's created for the support staff with an individual plan for emergency care for the student. It's developed to clearly instruct school staff on how to manage a specific student's medical emergency. And it provides a step-by-step set of procedures for school staff to follow in an emergency situation. So typically it's really kind of a more condensed plan that has, the really important emergency steps. So there's not as much to read, and in an emergency situation, we know quickly what needs to be done. Okay, next slide. Another tool that we have found to be very useful in school is the Seizure Smart Schools training. And this is something that's been developed by the Epilepsy Foundation. It is a training for school personnel that's provided by the Epilepsy Foundation. And it reviews just the basics of seizures, and it helps to enlist the full cooperation of school personnel and family. It enhances our ability to manage seizures and any consequences, and provides school staff with information to recognize potential seizures for students who aren't yet diagnosed. It ensures full integration of the student in school activities with appropriate accommodations and helps to minimize stigma. And I just have to say that this has been a very helpful tool for training of our school staff, just for their awareness as well as comfort level in recognizing and responding to seizures. And it has actually helped lead to diagnosis of epilepsy in some students where it was previously unknown. So it's been a really great tool for us. Okay, next slide. And then just some suggested additional support. So just remember that if a student is having uncontrolled seizures, that can really affect their learning and their school day. And if that's something that just has been really ongoing and not really coming to any resolution, we would suggest going to either an epileptologist or a neurologist in any of these times. So if a student fails 2 or more appropriate trials of seizure medications, if their seizures are uncontrolled or the student enters status epilepticus, or if there are major memory and learning deficits, that would be times when that might be an appropriate next step. And an epileptologist is a neurologist that has gone through additional training in the focus of epilepsy. So they have, a lot of very specialized training around seizures, and they might be able to help really figure out what's going to work for that person to get those seizures under control. Okay, next slide. So a little bit about impacts on learning. So some of the things that we might see, some possible learning challenges would be around attention and concentration, understanding instructions, some changes in memory, levels of energy and organization. And some possible causes for these would be frequency of seizures. So if somebody's having just a lot more frequent seizures and, maybe potentially it's even at night and not known, possibly the location of the seizure activity in the brain can definitely affect those different areas, the type of seizure, any medication side effects, and the age of onset. So just some helpful strategies to keep in mind, making sure that we have an up-to-date seizure action plan. And if it seems like we're, some of these effects are really getting to be more of a challenge, that action plan might need to be readdressed. Also having, good communication with parents or guardians. And then another option would be going in for some neuropsychological testing. So just some further testing of that person's learning. Okay, next slide. Some possible accommodations. So these are some different strategies that we could use to help that child or that person in school. And this is not a comprehensive list, but these are some different ideas. So providing oral and written instructions. So having more than one way of getting those directions. Using a tape recorder or assistive technology to record the directions. Having the student repeat back directions. Reteaching the content. Possibly that could involve taking a recording of the lesson and then listening to it again later. Reading and explaining the problems. Giving assignments one at a time. Provide a summary, outline, or a visual aid. Number and sequence the assignment into simple steps or highlight, the really important parts. Allow extra time for task completion. provide alternate activities, group similar problems together and reduce the number of problems, allow use of calculator, math fact table, or a number line, adjust test taking to a private space, or extend their time for tests. Next slide. And then a couple other areas just to keep in mind in the school setting. So field trips. The parent and school nurse should discuss any considerations for, potential seizure triggers if there's a field trip that's going to happen, the need for supervision. So who is going to be the one that's in charge of the seizure action plan and any medications that might be needed to be given. And then any safety concerns such as, if there's going to be height, water, anything like that around with a field trip. And then also for emergency evacuations, plan to have the child leave the building prior to a planned fire drill to avoid triggers such as loud noise, flashing lights, if they are known triggers. And then make sure that there is a plan in place for other drills or true emergency situations. And that there's somebody that's going to be responsible in that situation to help that child get out of the building. Next slide. And so the next topic is just some different strategies for communication when we're working with schools and parents. So just kind of briefly, one of the things would be just to be self-aware and to, think about this idea of the elements of personal communication that, about 7% is spoken words, and 38% would be voice and tone, and 55% body language. So just keeping that in mind, that's how important those unspoken parts are of communication. Next slide. And just that our goal is to collaborate and work together to optimize student success, and that, so every person on the team really, collaboration is so important that we can just really all work together, and that our main focus is that student and their well-being. Next slide. And then, this is a little bit about conflict and just some of the different causes of conflict. And just to keep in mind, there are many different types of conflict and different components to those types of conflict. So, there's going to be a lot of different things that are playing into that. And keep in mind that everyone is coming from a different place and perspective. And often conflict arises from miscommunication and misunderstanding. So really, the more that we can have open communication and make sure that the person is understanding, the better. And next slide. And then we just have a couple of tips on ways that parents can get ready for an IEP meeting, or some of this could also, apply to any other, like if it's a 504 meeting or different kinds of meetings in the school. So kind of the first step would be to organize your records and your thoughts, and then get copies of items that are not in your files, such as missing evaluations, or if you wanted to get more information on the law, so that you are really prepared and aware of what the law actually says in the different instances. Then number 3, make a list of your concerns, questions, and the recommendations that you want considered in the development of the IEP, and then put them in order of importance, so that you have that all down and you're prepared. Number 4, talk to your personal advocate about what the meeting will be like and plan what his or her role will be. So that would be if you had somebody that you wanted to be there with you, that's really helps you advocate for your child and for yourself. Number 5, write down statements that you want to make to the IEP team so that when you're in that meeting, you can remember what that was really important to you that you wanted to say. Number 6, you could write out self-statements that you'll make to yourself for personal support. And then number 7, kind of rehearse your role in that IEP process, including management of any difficulties that you think could arise, and rehearse again. Some of those IEP meetings can be really kind of intimidating to go into, when there's a whole team of people that are talking about your child. And so just, anything that you can do to help prepare ahead of time is really going to help in the long run with that process. Okay, next slide. And this is just one more, it's just a little bit different version of an IEP checklist that might be helpful to you. So it's kind of similar to the last one, but just a few different things. So number 1, before the meeting, you want to prepare and reflect. So check out the invitation that you got, know what the meeting is about, and respond to it. And then you want to prepare and get organized. So you could review last year's IEP if you have one already in place, and then request a copy of any proposed IEP. And then you want to reflect. So ask your child what he or she wants to work on this year. So you can have some input from the child. And then prioritize a list of your questions. Create a vision statement for your child's life now and in the future. And during the meeting, you want to ask and take part. So really, participating, staying engaged, share your ideas, and make sure that you understand your child's IEP. So if there's something in there that you don't understand, that doesn't make sense to you, ask questions until you understand what is going on with that IEP. After the meeting, organize and review. So wrapping it up while it's still fresh, you want to review that new IEP. And then, you could send out like a thank you or write a letter of clarification if you need that. And then just kind of that ongoing engagement. So participating in any data collection, communicating with the team and sharing success, and then addressing any issues as they arise. Okay, next slide. And this last one is just thinking about active listening, as another strategy to help with communication. So, there's just giving, 100% of your attention while you're listening, really hearing that content, trying to really kind of stay neutral and listening for feelings, observing body language, having awareness of the context and self-awareness, having clarifying techniques. So if there's something that was not clear, asking for clarification, questioning with curiosity, and paraphrasing, summarizing, and then really being empathetic. So those are kind of all the different parts to active listening. And I believe that is our last slide. And we can move on to questions.
All right. Well, wonderful. Thank you all for being here. And I just want to remind you again that you have that Q&A spot. So if you've been thinking of some questions and haven't put them in there yet, now is a good time to do that. So again, you can go to that spot on your computer that says Q&A, and that would be a great spot to let us know what you're thinking about. One question that I'll throw out to you right now is, and sometimes this happens, parents will say, I really want my kids school educated, but one, they don't know if they can ask for it, and they can, but then they wonder what happens if the school says no. So sometimes it's the school nurse or the principal who they're asking. And so we can talk about that. Both Lynn and Shayna have had seizure training. They're great at helping make sure that happens, but sometimes that education doesn't always happen for the school. And so one of the things that we can talk right now about is the benefit and maybe what parents can do, how to either get that training at their child's school or what to do if they hit a roadblock, if for some reason the person that they reached out to says no to it. Has that been your experience at all, Shayna or Lynn? Have
You
you
know,
ever had a school staff member not want the training that the parent is requesting?
Um, really the only thing that I've ever come across is just that they're not providing the time for it. And just that it's really, there's so many different pieces of training that they're trying to fit in that that's kind of where I've at times had to really push, more for the importance of having that training done. And so I think the more that you can bring that up and advocate for that, I think that that's a really important training that everybody gets. And if somebody is saying, well, we don't have anybody with epilepsy or with seizures in our school, so we don't need it, that at any time somebody could have a seizure, and so that just is extremely important that staff know how to respond to that. And so, to me, that's not really a valid argument against having seizure training.
And I would add that even just the awareness around the training and knowing that it's available, I think especially a lot of the staff, it's that anticipation and that apprehension about not knowing what might happen that scares them rather than talking about it and putting it out there. And the other thing I would add is for a parent, you don't have to wait for a meeting date. If you've got a concern, please go ahead and bring it up. If somebody has a question and I can't get it answered, I will get back to you. And the other thing I would say is just that day-to-day communication is so important. If it's something as simple as making a phone call to me and saying, they didn't get breakfast or they missed their med or any of those kind of things, then we can problem solve it right there rather than, spend the day, a miserable day because it didn't start out right. But I would say it's been very well received at our schools. And the other thing about the training is it can just be the general, but the other thing, it can also be kind of student specific, especially in some of our classrooms. We have a lot of kids with seizures, so they can kind of model it towards those particular students as well.
Absolutely. And I want to mention that we have different options for seizure training. So we can come in person, which has been historically how we've done that. So sometimes we train an entire grade level at once, or it might be an assembly with multiple grade levels together. And we make sure that it's age appropriate. And so it's really at the right level for that age group. So if we're working with young children, we're making sure that they just understand at a very basic level what seizures might look like, how they can help, like getting a grown up, not being afraid, what they should look for, and some simple steps that they can do to help while they're waiting for an adult to arrive. We play some games like Simon Says to help understand how the brain works. We have a pretend brain that glows that can help the kids understand that the brain has electricity. We have a couple books that we use. And then as the kids get older, the content's a little bit deeper and always at their level, interacting with the students and making sure that they are understanding how to be a good friend and making sure that kids know that kids with epilepsy are just like other kids. They just happen to sometimes have seizures. And so they can be done in person or via a Zoom meeting like this or Google Meet. And so they can be done virtually live. And we also have some recorded options. And so we have those on demand if that works better for schools. Sometimes they can just log in at their leisure and use those tools. And that goes for the staff training as well. And so the same options exist for how schools can have their teachers and school nurses trained. And not everyone is aware yet, but we are excited to share that Seizure Smart School legislation did pass. That goes into effect during the 2022-2023 school year. You can find more information about that on our website. If you go to Seizure Smart Schools, it provides all the information you need to know that you can also share with your school. And so it doesn't require all the teachers or all the students to be educated, but it does require that there is an action plan for every student who has diagnosed epilepsy, that there is someone who's educated that will be there at the school to be able to respond. Schools can always go above and beyond what is being asked by that legislation. And so we continue to work with schools to provide the supports that parents are looking for to ensure that they have that information shared with staff and students to make everyone feel comfortable. And to what Lynn said too, it's always up to the individual and the child. Sometimes that kid wants to come out and share that they have epilepsy. I spend a lot of time in classrooms, and oftentimes students decide ahead of time or even in that moment that they want to share with their class that they have epilepsy. And that can be really empowering for that student. So just want to share that that is another piece. It's always up to that family if they want to remain anonymous or if that student wants to be engaged and to share openly about it with their peers. So we do have some questions that are coming through. And so I'm going to go ahead and answer this one. So how do I know I may need to see a neurologist for my child? How about when do I know if I need to see an epileptologist? And so let's start with that question right now. So sometimes people are wondering, how do I know? Lynn or Shayna, do you have anything you'd like to share about how someone would know neurologist versus epileptologist and when?
So I would say anytime that the seizures are not being controlled, if the medications aren't working, sometime at those ages of puberty where things are changing. And again, have that conversation with your primary doctor, and they're most always willing to share or bring you on to the next step. Sometimes there's things that they can still do that they haven't tried. And if not, they're pretty good about saying, hey, this is a little bit tricky. We need to take this to the next level.
Yeah, and I think that can, taking that next step can also help to potentially identify triggers, if that's something that you're not figuring out. And it's not always possible to figure out what those triggers are, but that might be, they might have more ways of doing some testing to figure out what's going on for triggers and, just what other options there are available. So that might be a time when you want to take that step.
Yeah, absolutely. And, and as we mentioned earlier, if we see that the student's seizures aren't well controlled, sometimes parents are looking for that next step, that next, or they're looking for other treatment options. So maybe they've decided their child's failed a couple meds and they want to think about surgical options or device options. So it's always up to individuals and their families to decide, when it is that they want to pursue maybe an epileptologist at an comprehensive epilepsy center versus maybe seeing a neurologist at their local level. And so there's a lot of decisions that go, into what option might work the best for someone. All right, the next question that we're going to look at is, are there films available for parents and staff to view that show people having different types of seizures? This can help staff become acquainted with the visual part of people having seizures. So thank you for asking that question. So the trainings that we do for the teachers, the school personnel, it has some video clips embedded that work really well at helping understand focal impaired awareness seizures, what an absence seizure looks like, what a tonic-clonic seizure looks like. When we do childcare trainings, we also have infantile spasms and atonic seizures included with little video clips. And then for the students, for the older students, we use some of the same video clips that we would use with our adult audiences, but we also have a little video clip called Take Charge of the Facts Junior that works really well for teaching young children about what a seizure might look like and feel like. And then there's another, it's from the UK, excuse me, and it has some nice video clips that were put together that show different types of seizures that I also often use. And so if anyone's interested in those video clips, I often use them when I'm visiting classrooms or share them with teachers, but I'd be glad to share those with parents too. And those are tools that then can be shared with the school, either directly from us at the EFMN or by the parents, but absolutely, we know the value is so important to have someone visually see what they might be looking for. One thing too I'll mention is some parents have video of their child's seizure, and they sometimes bring that into the team to say, I want you to see this. So I know, so you know what to look for. And so that's always a choice that the parents have. If you want the school to know for sure what to look for with your child, is to maybe have some footage, if you have it available, to share with the staff that they can be familiar with your child's seizures.
We have
Anything else?
we have also done that in the classroom at the parents' request. Took a video clip of what we were seeing in the classroom to go along with that seizure observation record. Let's say, I think Shana had mentioned they usually do it 2 weeks of data or whatever, and they have an appointment coming up. So that's just one more thing that they brought to the doctor. Again, you sure would want to do that with the parent's blessing, but it's also a piece of information that can be valuable, especially if we're seeing it in school and they're not seeing that at home.
Absolutely. And it looks like we have one last question that I'm going to go ahead and answer, and then we're going to wrap it up here in just a moment. So the last question is, can you say more about treatment options other than medications, how to know when to look for a different option, and if we've seen students have success with implanted devices or brain surgery? And so usually what we know is by the time someone is on that third medication, there's only about a 1% chance that that medication is going to effectively work. And so that might be when they start talking to their doctor about, are they a candidate for surgery or a device? So it's always going to be case by case. There's a lot of testing that goes into that decision. For some people, they might do something minimally invasive like the visual laser, where it's guided laser ablation. Other times, someone might have resective surgery to help remove the part of their brain that their seizures are coming from. In fact, I had that surgery 19 years ago this Monday. And so 19 years ago, I was still in the hospital recovering. And so my surgery was successful. I've been medication free for 16 years. Some of my clients end up staying on medication, but they are seizure free. Some have less seizures, so they have an increased quality of life, even if they still have to stay medicated. And so there are benefits that can happen from brain surgery, even when it doesn't completely eliminate seizures. So the resective surgery is a common one. For someone having atonic or drop attack seizures, they can sometimes do a procedure called the corpus callosotomy, where they split the hemispheres trying to interrupt the pathway. There's other surgeries like the hemispherectomy. And so know that it's going to be case by case based on the type of seizures that the person is having and which option might be the most appropriate for them. And then there's a few device options, including a vagus nerve stimulator implanted under the chest on the left side of the chest, and then it connects to the nerve and then goes off at intervals, and a magnet can be used to swipe in between intervals. And then in addition, there's RNS, responsive neurostimulator, implanted in the brain on the cranium, detects a seizure before it happens, stimulates that area of the brain. Or another option is deep brain stimulation. Deep in the brain, goes deep into the thalamus on both sides, 2 generators, and not the focal point of the seizures, but an area deemed to help prevent seizures. So know that those are conversations anyone could have with their doctor about, is my child a candidate for brain surgery? Is my child a candidate for a device? So the best way to figure that out would be to start having those conversations and determine with your doctor if one of those options might be a good fit for your child. All right, so we have just a couple more I want to get to quick before we end. And so Carol, good points. Team EFMN with cell phones, easily accessible. What a great idea to film your loved ones for your physician. Thanks for that feedback, Carol. And then one last thing, my son is part of the cannabis study. Thanks for sharing that with us, and is working wonders. So absolutely, sometimes people, like in your case, are joining different studies to help improve the situation for others by being part of that initial group to help figure out what can work for others. And so we're so delighted to have each and every one of you here. We're going to go ahead and I know we are wrapping it up on our last few minutes here. So I'm going to finish with our last poll question right now. Go ahead and answer that question. Please choose one or more areas in which you have increased your knowledge after completing tonight's webinar. So how epilepsy and seizures impact education and learning, knowledge of tangible tools and resources related to epilepsy, key components of the different options that we discussed today, or effective communication strategies. So go ahead if you wouldn't mind sharing which areas you've gained today that have helped you in your understanding and tools that you can use. Wonderful. Thank you so much for sharing. I appreciate everyone who has participated, and I'll give you just a moment longer to finish your answer, and then I'll end the poll so we can see the results. All right, I'm going to go ahead and end the poll, and it looks like everyone has gained some new tools tonight. So thank you so much. You should be able to see the results on your screen at this time. All right, and I just have a couple final slides that I'd like to share. You'll see our mission here. We lead the fight to overcome the challenges of living with epilepsy and accelerate therapies to stop seizures, find cures, and save lives. On this slide, you'll see that we provide free information services, which includes free one-on-one support, customized tools and resources on a variety of epilepsy-related topics, and we also can help with material requests. So please feel free to reach out. You can see our website there on how you can learn more about information services, and you can reach out directly anytime to me or any other EFMN staff. Would be glad to support you with this area. And then these are just some final references with regards to tonight's training. So just wanted to mention these are available too upon request if you want any specific information about the references that we used this evening. And also wanted to draw your attention to our next webinar, which is on employment and epilepsy. And it will be on Wednesday, October 27th from 6:15 to 7:30. And our guest speaker for that will be Cindy Tarshish from ADA, Minnesota. And so just like tonight's webinar, you can register online at our website for more information. You can always reach out to us if you have any questions. And with that, I just want to thank you again to Lynn and to Shayna for being here, for sharing your expertise with us this evening. We are so thankful and delighted for you being here, and just appreciate you being part of this.
Thank you, Lisa.
Absolutely. Thank you. And thank you to all the participants who are here this evening. Again, if you have any questions that weren't addressed in tonight's webinar, you can always reach out in the future, and we're glad to follow up with you and answer any questions that you might have.